Got neck pain, got low back pain, getting numbness and tingling down into the hands or numbness and tingling down the foot into the leg, been diagnosed with stenosis? This video is for you. What's up, everybody? Dr. Matt Maggio here, creator of the Peak Method and founder of the Soft Tissue Revolution, and we're on a hell of a mission to make chronic injuries obsolete by helping people that are injured and in pain get properly educated and informed on their injuries and access to quality hands-on soft tissue treatment so they can avoid bigger problems down the road, like pain pills, injections, and surgeries, which only make things worse. So back at it for Ask the Doc. Got a great question from Leah on Facebook. Says, I'm 42 years old. I have had 2 car accidents and I sit at a desk all day long. Over the past few years, my neck pain has gotten progressively worse to the point where I had to do some epidural shots to relieve the pain. They only lasted a week. Just had a new MRI done and was diagnosed with multiple levels of degenerative disc disease with stenosis. The stenosis part scares the hell out of me, and I have seen 2 surgeons and both want to operate, but the idea of having surgery on my neck really freaks me out. Can stenosis get better without surgery? If so, I'd love to hear how. Thanks so much. Thank you so much, Leah, for that question, and sorry to hear that you're dealing with this. Yeah, when you see things like that on an MRI and stenosis, you know, the surgeons love that because they can scare the hell out of you. And it is something that you should definitely pay attention to, but surgery should definitely not be your first option. So let's just break down what stenosis is itself. Basically, what it means is that you have your discs, and we talk about this all the time. Your discs are like a jelly donut that's in the middle and it's a cushion. And over time, with bad postures, accidents, trauma, sitting at a desk all day long, lack of movement, the muscles around there get overworked and they develop a lot of scar tissue. So they put more pressure down on those discs, and those discs actually start to rip and start to tear. And when they rip and tear, they actually can start pushing back, and that jelly-like substance starts to seep out and it can push back on the spinal cord itself. And that's what stenosis means. It's like basically like someone's going in there and putting pressure on your spinal cord. And that can be a problem. You know, stenosis left unchecked over time can be a big problem down the road. But you don't need to jump into surgery right away. And you have to remember, surgeons, they operate. That's what they do. That's their tool to fix everything. Very hammer and nail. But I've seen a lot of these situations, and you're only 42 with this. So I've seen a lot of these situations where people go in and the surgeon's like, yep, we'll just go in, we'll clean up that area, we'll do a little bit of a fusion at one area, and you'll be good to go. They don't really tell you how it's going to be 4 or 5 years down the road. So one of the most common surgeries for someone presenting with stenosis is basically they go in the level that's bad, and you have multiple levels, but what they do is they kind of stick one together to the other, and then you really don't move in that area. So it might buy you some short-term relief and take some of the pressure off, but then what happens is above and below that have to work a lot harder, and then you have bigger problems down the road. Now you start to have problems at those levels, and it goes, and before you know it, you have a multi-level fusion. Now, you saw this as well. You said you got some epidurals, and epidurals, I think, are very dangerous because what they do is they take away some of the pain, but they don't fix anything. It's kind of like your check engine light came on, you said, fuck it. Oh, I swore. You said, fuck it, and you unhook that and then just kept going and your engine blows up. That's what happens when you do treatments that only take away the pain, but don't improve any function. So yeah, it can be scary. And things that you want to look for when you're having stenosis is like, if you're having like constant pain down the arm, you start to lose some function in there. You start to notice some issues where you're having trouble breathing, even some trouble going to the bathroom. That's what can happen because over time, it can put pressure on there. And when you have one up in the neck, it can cause problems all down the entire body because that's where your spinal cord starts. But what I would recommend first is getting to a practitioner, specifically one trained in my method, the Peak Method, that specializes in soft tissue treatment, and let them get in there and clean up all the scar tissue around the area. You're going to have a lot of scar tissue in the muscles, in the ligaments, in the tendons, and it just creates like a vice in there. So if you can get in there, get those muscles to take the pressure off of there, and relieve some of that in there, it's going to take some of that pressure off and reduce some of that stenosis. One thing I wouldn't do with this is get a chiropractic adjustment. because it's actually not going to do a whole lot long term. It can actually progress some of that stenosis in there as well. But stenosis is a scary thing, and you should be scared, but you don't need to jump to surgery right away. Get multiple opinions, reach out, find practitioners that can get in there and do a functional evaluation and really figure out what's going on. So thank you so much, Leah, for sending over that message. Really sorry to hear you're dealing with it, but there's still hope for you. You're still young. There's things that you can do now if you really start thinking how things are going to be long term. And that's what the surgeons do, is they think in a very short term. They're like, yeah, we'll go in there and do this surgery, but you're only 42. You had 5, 10 years, 15, 20. Things are going to be messed up in there long term. So don't jump to surgery unless you absolutely need to do it. And in your situation, doesn't sound like you need to, and the risk reward is going to be a lot different if you don't figure it out long term. So thanks again for sending over that video. If you like the video, give it a comment, a like, or share. If you got any questions you want us to specifically cover, send us a message. We're always here to help, and we will see you on the next one. Bye.